Hi there, it's Maya McNulty. I want to share with you today something that I learned that I think that you will value as well. And it's the way we think about healthcare. Now, I've done a presentation on the way we think about healthcare is dead wrong, but I also just learned some things that I think I wanted to share with you so that you can better understand how to transition in this new life of healthcare. I'm a COVID survivor, 3 years, March of 2020. And the way I was looking at healthcare was that it was kind of like against me, right? It was expensive. It was uh, hard to get appointments. I wasn't getting the right doctors. My prescriptions were out of control with the cost, the medical cost. And so, what I realized in this meeting was the transformation in healthcare is that how we don't really realize what is going on behind the scenes. We only see it like here and now, right? And doctors are going through a lot of issues such as burnout, understaffing, the stress of taking on longer hours, the stress of picking up after someone else's shift because they had gotten sick to COVID and or other diseases like cancer. So their resiliency had changed, right? They went to school for 8 to 10 years. And I know what you're thinking, that's them, that's not me. But you know what? In some way or shape or form, you probably have gone through some type of training. And I hope that continuing education is very important to you as it is to me. But it's it's as if we've been challenged over and over again in our resiliency. Now, for me, my resiliency with coming in front of this disease and the sickness and this disability of long COVID, it's been difficult and it's been challenging because I've been gaslit. I've lost friends. I lost family. I've lost finances. I've lost work. 3 years I haven't really worked because of long COVID. It disabled me. I wasn't able to drive for 17 months. I lost my voice for 10 months. I lost my hair. I was in a wheelchair for 3 months. I mean, these things all play a factor, right? But the resiliency, the challenges that keep coming up in healthcare and overcoming the burnout, overcoming the shortness of staff, the long hours, and staying healthy for your patients. And so what I learned from three doctors and one person that is a director in a New York State oncology hematology. I was getting blood work done every few weeks because we wanted to figure out how many antibodies do I have, what's my IG, and all these other things that I needed to learn for my health. And prior to COVID, I had no medical knowledge. I was just going for my annual physical because I've never had any medical conditions or anything like that. But I was able to listen to the president of one of the hospitals. I was also able to listen to a cardiologist and a vascular surgeon. And then, of course, the hematology, and then another person that's in healthcare who was in private practice, a surgeon, and also now in healthcare, one of our big HMOs. And learning their perspective was very insightful and very moving to me because what I realized is they are struggling with burnout, right? We had no framework or even knowledge of how to deal with the pandemic, much less how to go to work with it, right? We've had to all adjust as first responders or as healthcare workers for ourselves and for our family. So it was really important that we had flexibility, um, and that we kept our resiliency up, right? We never asked doctors how they're doing. We've always went in as patients, like right here, take care of me, I'm sick. But we've never asked doctors. We always ask, what was the patient experience like? But what was the doctor's experience like? Because many people are suffering with PTSD and behavioral problems and verbal abuse, especially when it came to masks, like having them thrown at you or spit on you. It's really uncalled for, but the mental health is really up there now. It's really high. And we know that one in 1 in 5 people suffer from mental health. And now it's even probably higher because of this pandemic. So there's some things that we have to start addressing. And we have to start knowing that how the doctors are human beings too, and that they have feelings. Nurses, the techs, everyone also, we have to give that human experience, right? They're working 10, 12 hours a day. And today in our society, we can work 10, 12 hours too. We can even download an app, Instacart or Uber or even Airbnb and work 3, 4 hours a day if we want, or rent out a room in our house and make some money. So it's so important to know, like, things have changed and things have shifted, and doctors are talking about technology and how technology has been innovative, and it's actually been helping them. It's helping them with academics and connecting with high school kids and college kids in reference to the remote work life, and also the grassroots movement of wellness in the schools. We won't deny that working remote has been weird for all of us, right? It really has. Um, the innovation of learning new technology. We went from the typewriter to the keyboard computer to now ChatGPT, right, where they can do everything for us. Long gone are the days where you're just going to start Googling, what are the best remedies for a cold or a headache? You can just type that in chat and it'll spit out an answer for you and give you a protocol. And I think that how it's also great because I know for the past 3 months or 3 years how I've been going to the doctors, and I can't read their transcript because it's made in the medical terminology, and so for them to be able to use chat in house with the radiology or wherever they're using it, for you to leave with a piece of paper that like you can read and understand is really going to be beneficial. It's really going to be beneficial. So I see that they're embracing this new technology and innovation, and also the academic part of it. But yeah, ask your doctor, what's your experience with your patients and how are you feeling? Bring that human touch back into it. I think that's so important. And I'll leave you with this. One of the best quotes that I heard today was, let me find it here. It Oh, yeah, here it is. Sometimes if we're not happy with our physicians or doctors, we can go and get a second opinion or a third opinion or a fourth opinion. And for me, I did that. I went to 3, 4, 5 doctors, especially neurologists, because they all gaslit me and asked, and then told me, well, what's long COVID? And long COVID isn't real, and I've never heard of it. And as we know now, fast track, as this video is being made March 9th of 2023, and things change. But it's not a psychosomatic thing, right? And and one of the quotes that I heard today was, I don't know a patient who wants a second best doctor, right? So when you think of AI, or you think of wanting third and fourth opinions, or going for another doctor after another doctor, I mean, they're trained, right? They went to school for this, and they're learning. uh and yeah, so I don't know any patient that wants a second best doctor. I thought that was brilliant. That was a great quote. I think that how there's also some disparities with healthcare and with health insurance, and also like being able to have Medicaid or prescriptions for your medicines, and how expensive it is. It's not a secret. We know that the past 3 years have been the worst when it comes to health and medical insurances. And I'm not proficient in that, but I do know that the population is the largest it's been, given that the fact that we're 8 billion people in the world now. Um, and in America we have at least 4 billion of them, and so most of it, because of disparities, they have not been able to get prescriptions and medicine and see doctors, and so therefore the deaths in inner city youth and children and black and brown communities especially have risen. And Medicaid costs, there's just too many people and not enough coverage, or if they can't afford it, it's just way too expensive to get the premium package. Because as you know, we know that how if you're paying for medicine, you are getting a better, if you're paying a higher premium, you're getting better doctors and better medications and prescriptions and stuff. So if you leave with this video today, I want you to stop paralyzing yourself for being human. You are human. And take the time to listen, care, nurture, and ask other people, what's your experience? How are you doing? It's okay to do that. I want to say thank you so much. If you haven't followed any of my videos, go ahead and do that now. You can click the link and follow me. And I know I have these stars things happening now, so you can do some of those as well. But this is Maya McNulty, and I have been a COVID long hauler for 3 years. And I'm hoping that my message and the message of hope gets to others that need it. Keep on fighting. And if you want to leave me a comment or a message, I'm happy to get back to you. Have a great day, everybody.